Hello and welcome to this KHQ MD update. With us today from Advanced Aesthetics, Dr. Kevin Johnson. Doctor, thank you for joining us today.
Thank you for having me.
Dr. Johnson, cosmetic surgery seems like a pretty popular topic for most people these days, and it feels like everybody is talking about reality TV cosmetic surgery or new procedures and new approaches to look younger and feel better. What are the most common cosmetic questions and requests you get from your patients?
Well, I would say by and large, most people are looking for either body sculpting, something in the way of changing the way they appear in clothes. They would like to do liposuction or something to alter either their torso, arms, legs. But I would say a close second is probably rejuvenating the face, making changes to improve the appearance of the aging face.
Are these people looking for a surgical facelift?
No, by and large they're not. Most people are afraid of the idea of a facelift and would much rather do something that's less invasive. First we start with the skin, and this is a procedure that can help with the appearance of the skin. It's a fractionated CO2 laser that you can see operating there. What it does is it adds energy to the skin, and it allows the skin to rebuild itself and create a nice smooth appearance, and really changes the appearance of the skin and how it reflects light.
Well, tell me how you evaluate the aging face. What signs do you look for someone getting older?
Well, I think this is a pretty good example. In this particular patient, she's in her late 50s, early 60s, and she has some very typical changes that most of us undergo. As we keep having birthdays, we keep having changes. And we see the skin itself has lost some of its luster, some of the reflection of the light, and the mid-face has also lost some volume. Patients also lose volume in the skin, the muscle, the fat, and even the bone in their face. As a result, we try to take a look at the things that make us look older. It's not just lines in certain places, but it's actually volume. And a facelift really doesn't address a lot of those things. It pulls the face back, pulls the skin back, doesn't add volume back. And that's something that we're really focusing on these days.
So what are some of the treatments you recommend in someone who is getting a little older and noticing these changes and they want to look a little younger?
Well, that's a good question. This is a cartoon of what happens with the skin, that CO2 treatment that I talked about. What we're doing is applying energy to the skin. We're sending your skin basically to the gym. We have to work out to make our muscles bigger. We actually have to apply energy to the skin and make it repair itself and work out. And that's the idea behind using these laser treatments to improve the skin itself and thicken the collagen and elasticity. In addition, we use neuromodulators to help relax muscles that are creating active wrinkles, and also we give patients or use fillers, dermal fillers, in order to revolumize the places where we've lost volume. So a combination of those things, that's really the name of the game these days, are combination treatments.
So what kind of recovery time on these minimally invasive treatments? Well,
that's the nice thing about them. The recovery is minimal. People do really well with these treatments. Sometimes there's no recovery at all. They have some minor swelling the day of, and after that you just don't see them when we're doing filler treatments. Something as aggressive as a CO2 takes a little less than a week, but about a week to recover, which is a far cry from recovering from a facelift. You can see this particular patient, she had a combination of treatments. We did fractionated CO2 on the face to improve the skin. We used neuromodulators around the eyes and the glabella area in order to relax muscles. And we also used dermal fillers to fill in some of this volume loss through the cheeks, around the mouth. You can see the lips that changed the volume in the lips, the corners of the mouth, and the marionette lines, which have improved. All of those things make us look older, and a combination of those treatments added together really changes the appearance and makes somebody look much more youthful. That procedure was done in less than 2 hours, and the patients, like I said, the recovery was less than a week. So much different than facelift and some of the treatments of old.
Doctor, we've talked about the face. What about the neck?
Well, that's a great question. A lot of people do complain about the neck. They come in saying that they're blaming their mother most often about the fact that they have this waddle or the turkey neck, lots of different names for it. But that really is something that jawline definition is a really important part of looking youthful and looking in shape. And we can do something that's very impressive that really where the recovery is very quick. This is a smart lipo patient where we make a small incision under the chin, an incision out in this area, and what we're doing is defining the jawline and then removing a little bit of fat and then using laser energy to tighten the skin from underneath. Smart Lipo is not a surgical facelift. And if you can see, actually the scar, this is a picture 1 month later, the after picture, there's her scar. If you can see that, there's one under the chin and there's a similar scar on the opposite side. 6 months from now, you won't even see the scar, and you can see the definition, how things have changed. This angle has changed, makes the patient look more youthful and in better shape, and people love it. It's just a great minimally invasive procedure with a very minimal downtime.
Dr. Johnson, thank you so much for joining us today. It's been a pleasure. We've learned a lot.
Thank you for having me.
And thank you for joining us on this KHQ MD Update.